Hello everyone, it's Dr. Odette Suter. It looks like I am live, so a little hello from some people would be great, just so I know that you guys can hear me. And while you guys do that, I'm just going to share the link here to some other pages so that they can see it as well. Let me do that real quick. But I'm really happy to be here with all of you guys. It's really awesome. How is everybody doing, and where are you guys all tuning in from? I'm in the Chicago area, and it just kind of went from summer and hot to, well, not so much summer anymore. But, you know, that's how it goes. But I like the seasons. It's nice. I grew up in Switzerland, so we always had seasons there, so I kind of need that to feel good. All right, good morning, everyone. I see that you can hear me. That's awesome. Thank you so much for joining. So I'm just going to let a few more people show up here, give a little bit of time. Schaumburg, Illinois. Well, that's close. Oh, yeah, Lori. Hi, Lori, I know you. And then there's Barb, but she's in Florida right now, someone I know in this area as well. So anyways, it's so good to see you guys all. I don't know what the weather is like in your areas, but it's been quite rainy here. But again, it's been brown, so it's going to turn all green again, so that's great. Lake in the hills, lake in the hills. You guys are all in my neighborhood. That's nice. All right. Well, we've got quite a few people here already, so let's just dive right in. I want to talk to you guys a little bit about arthritis, but for those who don't know me, I wanted to just introduce myself. I'm Dr. Odette Suter. I'm a holistic veterinarian. I practice in the Chicago area. Oh, hi, Laura from Mexico. She's one of my veterinary colleagues, holistic as well. Hi, Laura. Thanks for joining. And Kelly, she is part of the holistic advice group that I'm on. She's doing a lot of work there and helping people. So hi, Kelly. Anyways, I'm going all over the place. Anyways, I'm a holistic vet, and I work with dogs and cats mostly. I used to do some horse work as well. So for all of you guys who have horses, please tune in as well and listen to it, because it applies to everyone. Actually, you guys yourselves as well. Anyways, so I'm a veterinarian who tends to work more towards being proactive and trying to prevent issues and doing things more naturally and so on. So I want to talk to you guys a little bit about that. If you want more information about me, you can also find me on my website, peakanimalhealthcenter.com. And I also have a book, What Your Vet Never Told You, and a video series, Animal Longevity Secrets Revealed, and a newsletter that you can sign up for. I will, as usual, write a little cheat sheet after this so that you guys can have that. So for anyone who signs up for the newsletter, you will get that in the newsletter, and I'm going to post some links here in the comment section with the links so that you guys have them. All right, so anyways, I want to start with a little bit of an introduction into the subject of arthritis, and then open things up to Q&A, so that you guys can ask your questions and share your concerns and so on. So when it comes to arthritis, the prevalence has definitely increased. So over the past 10 years, dogs tend to have much more arthritis than they used to. So there's been about a 66% increase over the last 10 years for dogs, and for cats, 150% increase. Nowadays, cats over 12 years of age have about 90% of cats over the age of 12 tend to show some evidence of degenerative joint disease, including spondylosis, which is arthritis in the spine, in the vertebrae. And in dogs, about 20% of the dog population tends to have osteoarthritis. It's most likely more. I'm not sure if they also included spondylosis in that. But that's a very important aspect of arthritis, which I'll get to a little bit. But first, I also want to talk to you a little bit about lameness issues, or reduction in what your animals normally do, because very often what I hear is people say, well, my dog or my cat isn't doing this as much, or all of a sudden something changed, or now they're not jumping into the car, or whatever it may be, or my horse is not switching leads, or is stiff to one side, whatever it may be. And not all changes in mobility are arthritic changes, because the thing with arthritis, it's not something that starts all of a sudden. Arthritis is usually something that develops over a long period of time, and I call it arthritis an archaeological finding. So it started at a very much earlier than you can actually see the signs, possibly. So that's why it's so important to also start treatment or maintenance of the body this early, because otherwise the issue just kind of builds up, and then all of a sudden we have arthritis. And once we have arthritis, it's it becomes a management issue, because we have changes in the bone structure, we have changes in the joint, we have inflammation, we have pain, and that's much harder to deal with than doing maintenance ahead of time. So I highly recommend that anytime for any animal, that you do regular maintenance body work, and make sure that they move properly, that they get exercise, that they learn how to use their bodies properly. For example, in dogs, doing a little bit of PT, even though they're not having any issues, is a good thing, because that way they can learn to use their body differently. For example, in large breed dogs, they tend to use more of their legs to move themselves forward and not engage as much of the core muscles, which are really important to maintain stability in the body in general, because then they're more likely to know where their legs are, and use them properly, and not be crazy hard on themselves. But it also helps to maintain the spine, which is very important, because as they get older and they get spinal issues, spinal arthritis, what happens is they end up with a narrowing of the spinal canal, which then puts pressure on the spinal cord, with all the nerves that are supposed to supply the muscles of the hind legs in general. It seems to be more of a hind leg issue, and that is much harder to reverse. Hi everyone, I'm back. I lost connection on my computer. Of course, there's always something. Can you guys hear me now? I hope so. Damn computers. Pardon my French. There's always something. Technology, you gotta love it when it works, but when it doesn't work, it's just challenging. And now, obviously, I lost my train of thought. I don't know where I was. So if somebody remembers what I was talking about, obviously arthritis, but yeah, I would appreciate that. And what I'm gonna do is I'm gonna, when we're all done, do a little bit of editing and put all the videos, together so that it's as one. But thanks you guys for all coming back. Yes, there will be a recap article, Stephanie, afterwards. So, oh yeah, arthritis as archaeology, right? Okay, so that's where I was, what I was talking about. So, and I was talking about the narrowing of the spinal canal. Yes, because I do have a lot of dogs that come to see me, where people think it's arthritis as the hips or the knees or whatever it may be, but what it ends up turning out is that they do have lack of a nerve flow to the muscles of the hind legs, and then it looks like they can't jump up on things anymore. They can't, oh God, now I see myself too. It's annoying. Double, and it's delayed. But anyway, so when they have issues jumping up on things, it doesn't necessarily mean that there is arthritis in those joints in the rear end, hips and knees and such. But it could also be arthritis in the spine that is causing some constriction, because nerves, they need to innervate the muscles, and muscles are really important also to help stabilize the joints. So when we don't have good stabilization of the joints, that can also make arthritis worse in the joints. So that's why exercise is so important, to maintain muscle mass of the legs themselves, but also around the spinal cord, all the core muscles. So that's why it's important to teach, young animals how to properly move, and how to do some exercises where they have to stabilize and be able to stand on three legs, for example. Because, for example, oftentimes when I do exams on the animals, I always check flexibility of the legs, extension, and that sort of thing. And some animals, I pick up one foot and then they fall over, if you don't hold on to them. And they should be able to stand on three legs. So those are easy things that you can do preventatively to help them out, have better balance and have better core muscles, to do things like that, like little exercises. So I recommend doing that, even if it's just a consult with one of the rehab vets, just to show you different exercises that would be good for your personal animal, so that they can build some of the muscles that are maybe not as developed as they should be. And certainly once they start having issues, it's a good thing to also do some rehab, because it's easy to not do anything and just say, well, my animal is slower, I'm gonna take it easy and not do a whole lot, which you have to when they're injured, obviously, and you have to adjust to what they can do. But one of the biggest mistakes I see is to not exercise them enough and maintain their muscle mass, because the less muscle they have around in their legs, for example, the more unstable the joints are going to become. So if they already have pain in a joint and they don't move as well and don't have as much muscle to help stabilize the joint, the inflammation will get worse, and the joint pain will, the pain will get worse, and then they will move even less, and the muscles, atrophy even more. So it's a vicious cycle, it's kind of going down the drain that way. So it's very, very important to maintain muscle as much as possible. Help them feel better so that they want to maintain their muscle mass a little bit better and want to move a little bit more. So that's really important. So oftentimes when I see an animal, or when I read posts, especially on some of these groups that I'm on, people always ask, well, what kind of joint supplements can I use and what can I do for that? Well, joint supplements are only one part of the treatment when animals have issues, because for one, you want to make sure that the overall structure of the body is functioning the way it should. So just because a dog, for example, can't jump up into the car doesn't necessarily mean that they have arthritis and need a joint supplement. They may just be a little bit off in the spine and just need a chiropractic adjustment. So I had one patient who was a little Havanese, and she had surgery in both of her knees because of patellar luxation. She was 3 years old, and the surgeries had happened, a while ago. Actively an issue necessarily. But she was acting like she was 14. I mean, she just looked like an old dog. And all it took was one chiropractic treatment, and she was back to her, normal self, started playing with her sister. And so, there's a lot of things that we need to examine first before we just jump to filling them up with joint supplements that we kind of randomly throw at them. So it's really important to do some good diagnostic workup, have your vet look at it, have your have a chiropractor, somebody who does some chiropractic work, look at it, do some acupuncture, things like that, just to kind of evaluate the animal to see what is really going on. Because that's really important, and the same goes for horses as well. I mean, so many times, I'm not the first one in line to be called when the horse is not moving the way it should, and that's really sad, because oftentimes all it really takes is a little, and they are back to moving normally, and how they should, and they are able to bend, they're able to switch leads, they're able to jump over obstacles better, they're better at doing whatever dressage move they're supposed to do, they're better able to, to carry themselves, they're less grumpy. And, same goes for all of the other animals, the dogs and the cats. So we want to make sure that we really look at the basics first, look at the structure. It's kind of like a house, you want to make sure that the foundation is good and the structure is sound. And then you can start to add, more stuff to it. You can start decorating, basically. So we want to make sure that, we examine the animal first, and do a proper workup, and figure out what is going on, rather than just, reaching for joint supplements, because you may not be able to get the result that you want, and then the animal continues to suffer, and it also becomes expensive. So I'd rather have you spend the money on figuring out the underlying cause and what the issue is. And then on that note, actually, I want to announce the winner of the question that I asked yesterday about what is the most important question to ask. And Susan Hunter, you were the first one to give me the answer that I was looking for. And we need to ask why. What is the underlying cause? What is the root cause of the issue? So congratulations, you just won access to my video series. So I'm so happy about that. So anyways, congratulations. And I got a lot of really good answers. I'm really proud of you guys. It just warms my heart about how much you all know, and, what you're doing for your animals, and it's just amazing. It really warms my heart. So thank you so much for contributing, to all of the animals' wellness, and your own animals, and thinking and being proactive and all that. So that's really good. All right, so anyways, let me go to the comments, because I definitely want to answer some of your questions here. So let me go down the line here. You can still hear me. I asked that about 20 times. I got lots of answers, so that's good. Marcel, I've been taking my Yorkie to a chiropractor every 2 weeks, and it's made a world of difference. I highly recommend it. That's really good. Is fecal transplant good for joint problems? Yes, it can definitely help a lot, especially if joint issues are more of an immunological, are caused by immune system issues. Because that's very frequently the cause, the case. Because we have to ask the question, why does, arthritis increase, or why has it increased that much? Why do so many animals have arthritis? There's obviously, the injuries, the wear and tear type of things, but there's also the issue of autoimmunity. And Purdue University, they did a study a few years ago about vaccines and how they affect the body, and they found that all animals that have had vaccines have autoantibodies to certain tissues and proteins in the body, and one of these proteins is collagen. And joints, cartilages, tendons and ligaments, and a lot of different things in the body are made out of collagen. So I think about a third of the body is actually collagen protein. So if the body is the immune system is attacking all that collagen, that will also affect all of the joints and cause issues in that regard, and cause arthritis and inflammation, etc. So
definitely if we do a fecal transplant, we help to restore better immune function, and hopefully that will decrease some of the inflammation and the damage that's being done to the joints and the supportive structures. For example, in dogs that have arthritis, they've also found distemper antibodies in the joint fluid of these animals. So distemper, the vaccine can, end up causing some immune issues there. There's also the thought that some of these cruciate ligament tears are actually have an immunologic component to them, because why would, this ligament rupture so easily? I mean, you know, nature didn't make the body to have one weak spot to continuously rupture. Sure, you have an animal that runs and then does a quick turn and then it ruptures, and they're screaming and in pain and limping, and the ligament is torn, but it worked itself up to it. So it's not, there's probably some weakness that started possibly immunologically, some attack of the collagen of the cruciate ligament and the joint, and creating instability in there, and then all it takes is just one little burst and impact, and then they have an issue with that. So definitely, making sure that the immune system is working properly and decreasing inflammation from that perspective is definitely very important. So that was a very good question. And then I was freezing again. Well, I hope, yeah, I think you guys can still see me. It doesn't look like I'm frozen right now. Susan, yeah, thank you. That's good. I'm really happy about that. All right, Sue Hunter, she froze at the moment she announced. Was the answer correct? Yes, Susan's answer was correct. What is the cause? But, the real question there was, asking for was why. We always have to ask why, because there's always a reason for something, and many of you answered that, after I gave you a little bit of a hint, but Susan's answer was definitely the why. So, definitely good. So now I'm thinking I should stop Maggie's glucosamine synergy. Carol Lewinson. Well, not necessarily. It's good to add joint supplements, if they need it, because it can help prevent things. It can help them feel better, especially as they get older, because everything ages in the body, including the collagen and the cells that make the collagen and the cells that make the lubrication, the joints, joint fluid. So it's certainly a good idea to give them some joint support, but we also want to find the underlying cause, and we want to support them differently as well. Because anytime they do have arthritis, and lameness issues in general, or weakness in the hind end, it's not, just one type of therapy is never going to be quite enough. It really requires a multimodal approach that includes diet. We want to make sure they're on an anti-inflammatory diet, low in carbohydrates, fresh, species appropriate, that has all the nutrients that they need. We also want to make sure that they get plenty of exercise according to what they can do, but definitely, enough of it. And then we also want to supplement if they have issues, if they have pain. We want to make sure we can give them some supplementation that can help decrease inflammation. But we also want to do body work so that we can optimize what's there and help promote better function in general, so that they feel more comfortable and want to exercise more, which I mentioned earlier. We also want to, there's laser therapy, for example, that we can do that can decrease inflammation in the body and the joints. It can make them more comfortable. We can use PEMF devices such as the CC loop. PEMF is pulsed electromagnetic frequencies, which brings more energy to the cells so that they can function better. Acupuncture, chiropractic work, other manual therapies such as massage, for example, myofascial release, visceral manipulation, all of these things can help. And for those of you who don't know what visceral manipulation it's basically working on the fascia of the body. And fascia is what wraps all the muscles, it wraps all the nerves, the blood vessels, the internal organs. It basically wraps everything. And you've all seen it, when you have a piece of meat that has a very, very thin layer all around the muscle, of that meat that is very hard to chew, and when you eat it, that's fascia. So that lines everything in the body and connects everything as well. So for example, if an animal has had surgery, there is scar tissue of that fascia, which then will affect everything else in the body, how it's able to move. So with visceral manipulation, we can help to loosen up that scar tissue so the fascia can be more the way it's supposed to be, because there's also a thought that a lot of, for example, cruciate ligament issues come from scar tissue that builds up after spaying and neutering, because as easily as they should. And I do have one patient that I'm currently working with who's had both cruciate ligaments torn and had surgery, and she has a lot of arthritis. And for her, what works best as far as manual therapy is doing that myofascial release / visceral manipulation. She always does really well with that. So kind of helping things to move better really assists the body in then having more mobility and being able to restore itself. Those are, things that can be done. And it always, everything always depends on how bad the arthritis is. If we only have mild issues, then oftentimes just doing some natural things can be enough. But when they have moderate to severe arthritis, oftentimes they do need some extra pain support in the form of drugs, because it really is about quality of life. We need to make sure that the animals can enjoy life and can, have some fun. Because if they have, arthritis bone on bone, it's kind of like in humans who have hip arthritis, for example. Oftentimes they wait for a long time and then they get surgery, and they, oftentimes what I hear is, oh, I wish I had done it sooner. So it's really important when the arthritis is more severe that we do something to really help them feel comfortable. Because I don't know about you guys, but if I wasn't able to move and was in constant pain every time I'm trying to move, and even be in pain even when I'm not moving, I would much rather have a shorter life, but a life with more quality, even if I have to take drugs for that. Obviously, drugs always have side effects, but in the end, quality of life is really important. And there is, and I'll post that in the cheat sheet. There's a questionnaire that you can answer for yourselves to see, to evaluate the quality of life of your animals, and see, how bad it is, and what, just so you get a bit of an idea, so, of the status of your animal. Because one thing that I often hear too is, oh, yeah, my dog isn't screaming. I'm like, well, if an animal is screaming in pain, that is a lot of pain, because, we walk around with pain sometimes, a little bit of back pain, a little bit of this kind of pain, and we don't scream every time we move. So if an animal is screaming, then that's a lot of pain. That's a lot of pain. Then it definitely needs help ASAP. To help manage that, because we don't want an animal screaming. And anytime an animal is limping, it means that they are in pain. So I often also hear that, well, my animal, oh, he's a little bit limping, but he's not in pain. I'm like, no. If your animal is limping, there is pain. And oftentimes they will also not show pain, especially in cats. It can be much more difficult to evaluate their level of pain. So it's important to kind of watch how they behave, how they change. Are they grooming themselves? Are they going into the litter box to, do their business, or are they not able to make it in? So just watch your animals, if there's any kind of change in behavior, change in attitude, if they're getting more grumpy, for example, or they don't want to be touched somewhere, just make sure you have it evaluated and checked out. Um, Unfortunately, with conventional medicine, all we have is drugs to help them out. But we have so much more with rehabilitation. We have chiro, we have, the holistic vets, and that can really help with that. All right, let me go back to your question. So, Melinda, does visceral manipulation benefit scar tissue in the lungs? Yes, definitely. Anytime there's any scar tissue anywhere, it can help. And, any animal or human can benefit from visceral manipulation because we all live, we things get a little tight and then it stays tight, and then the fascia around it kind of tightens up, and then it stays that way. And so even when we're sleeping normally again, it's still tight. So it can benefit everybody because we all need a little bit of maintenance. It's kind of like a car, you have to do oil changes every so often. So it's really good. I, for example, get chiropractic adjustments once a month. Even if I don't really have any particular issue, I still get it done and I feel a little bit better afterwards. It's just maintenance. It's just part of my routine. It's part of what I do for my body. I've been getting some visceral manipulation myself, and it's been really quite amazing how things have changed. I do a lot of dancing, so I really notice these types of things when my body all of a sudden can do things that it wasn't able to do, even though again there may not have been any pain, but all of a sudden there's something loose and I have better balance, I'm more centered, things like that. So all of these little things can help maintain mobility long term for the animals, and especially in our bigger animals, it's important because if you have a big dog that all of a sudden can't, or not all of a sudden, but slowly loses its ability to move in the rear, it can become very, very difficult on yourself. So it's very important to maintain their mobility because that also keeps them happy. Animals love to move, they love to go out for walks, they love to play, you know. So at what age should we start joint supplements? Well, that depends a little bit on the breeds. Definitely in larger breeds, probably a little bit earlier. You can definitely start, incorporating that in the diet at any time. It's a good thing because we want to maintain the body. So there's really nothing too early, but I also don't subscribe, um, to just throwing things at the animals. I prefer to be a little bit more targeted and more directed, but they need their basic nutrients. So just giving them basic nutrients through food is a very good idea. But especially in the large breed dogs that also tend to have a little more developmental issues, it's a good idea to help support them, from a very young age on, as they're, while they're still growing. But definitely starting when you start seeing issues is certainly highly recommended. A lot of the joint supplements, they take quite a while to kick in. So just because you don't see any difference in a week, don't stop. Please continue. Because it can, in some of the studies that they've done on, glucosaminoglycans, chondroitin, hyaluronic acid, glucosamine, it takes several weeks for the benefits to show because, well, it takes time to rebuild and relubricate, and so it takes time for that to change. Whereas, drugs like non-steroidal anti-inflammatories, for example, they're pretty quick because it takes the inflammation down very quickly. So sometimes we need a little bit of both to begin, and then we can find a dose that's, tolerable and provides enough pain support. Do I recommend x-rays as a first diagnostic tool? Well, that always depends on the condition. For example, if I have an older dog with a cruciate, with a knee issue, for example, I recommend doing x-rays because it could also be a tumor that's growing in the area, so I want to rule that out. It's always helpful if we have x-rays of the spine. It can give us some more information on how severe and what's going on. For example, in some breeds like pugs, they can, or they can have a malformation of the vertebrae, so it can help knowing that ahead of times, so that we be doing a little bit more maintenance maybe and be more proactive if they do have some of that going on, because they can be more prone to having discs that slip as a result of these malformations. Definitely, it's a good diagnostic tool. Do I use it in the first visit? It depends. Oftentimes I will just start with some chiropractic work and see how they do. And if they improved, that can be diagnostic for me as well. It can let me know that, well, yeah, they're actually, that was one of the issues. If the issue continues and they don't benefit from any of the chiropractic or body work that I'm doing, then I'm definitely going to look a little further. But I don't jump for it every single time. It really depends a little bit. All right, let me see you. What other questions? Marcel, I feed a raw diet, make homemade bone broth, offer foods with collagen, give glucosamine, MSM, vets best aches and pains, boswellia, dehydrate my own meats and offal. Well, that's all awesome. That's all really good, for your animals, definitely. My buddy had some knee issues last week. Should I use a joint supplement for him? Well, if something just happened last week, then I would definitely have it checked out, because there could be some more going on. Just throwing joint supplements at an animal is not, always going to help. It can support, but we still want to know what the underlying cause is and what's happened. Because again, like in that 3-year-old Havanese that I mentioned, just doing a chiropractic adjustment changed her entire life, and her mobility. So sometimes it's as simple as that, to, change things around. And sometimes if we work with joint supplements, that can take a long time to even show benefit, obvious benefit. We may prolong the suffering of the animal in that time. So I always recommend having them checked out if it doesn't resolve, or if they're in obvious pain for sure. All right, let me go up a little bit more here. My collie has back end weakness and also has incontinence. He's a 12-year-old collie, so we just figured it was old age. What kind of exercise should we be asking for? I guess animal vet chiro is the first step. Do you see incontinence linked to back end weakness? Definitely. I do see that as part of it, because the nerves that go to the hind end also go to the bladder. I mean, not the same ones, but from the same area. So if we have arthritis and narrowing of the spinal canal going on, it will also impact the nerves that go to the bladder and can cause incontinence. So chiropractic work can, make a big difference in that. I have a lot of dogs that have a little bit of chiropractic issues that benefit and respond really, really well to a little bit of chiropractic work as far as incontinence goes. I remember one dog that he was a male, older individual, and he was wearing a belly band, and so I tried to take the belly band out off, and there was a stream of urine that just kept pouring out. So I'm like, let's put it back on. But all he needed was two treatments, chiropractic treatments, and his incontinence completely resolved. And he didn't have to wear the embarrassing, degrading belly band, which he hated. But anyway, so to go back to the hind end weakness, yeah, we definitely need, benefit. The animals can definitely benefit from some chiropractic work, some laser, from acupuncture, and then also from exercises. And in those cases, I always recommend working with a rehab vet as well, because they can help you with different exercises. They can help, show you. And it's not necessarily that you have to go all the time. Sometimes just having a session with a rehab vet can help a lot. They can show you things that you can then do at home, because it's something that you're going to have to, do every day. It's not just a one-time sort of thing. Manual therapy can also help strengthen the muscles, because one of the most important things with hind end weakness is that we work on maintaining muscle mass, because otherwise they end up getting weaker and weaker, and then they can't even get up anymore. So we really need to make sure to keep working on maintaining muscle mass. And then there are other things that can help with these arthritic dogs, or these dogs that have a weak hind end, which are, boots that kind of that don't slip, because we want to make sure that they don't slip and hurt themselves that way, so that they can also get up easily. There's toe grips that you can, slide over the nails. That they're little rubber tubes that can also help them slip less. And then you can use mats, for example, yoga mats really help a lot. You can, use these children's play mats that you can kind of hook in together. Those types of things, runners. Just making sure that they can get up easily is really important, so that they don't hurt themselves. And then, if it gets really a lot worse and they really have a hard time with mobility, then getting them a help them up harness, so that you can help them up with the, they have handles in the front and the back, so that you can help them get up more easily as well, which is also very important for you, because it can be very hard on your own body. So that can help, boots, things like that. So there are a lot of things that are out there and available to help your animals with arthritis. I hope that answered the question. Yes. Do you recommend MSM alone for older horses over 30? Generally, multimodal approach is the best. So in an older horse, I would work chiropractic work, some acupuncture. They can benefit from laser. There are PEMF wrap things that you can put on. There's the CC loop that you can use. There's CBD oil that can be very helpful, and just in general joint supplements. I wouldn't go with just one, because one alone is usually in very, in older animals, when they have more severe issues, isn't it not going to be enough. Horses, it's also important that they are able to still get up and down, so that they can get some rest and actually sleep, even though they don't do a ton of that. So if they need a little bit of support with drugs to help them with that, I think it's important, because quality of life is certainly important. Keeping them warm in the wintertime, depending on where you live, is important as well, because sometimes with arthritis they get worse when it's cold. Making sure they move, even if it's just, moving gently. A lot of the horses do really well in an environment where they can go in and out and move. Spreading the hay, in different areas to actually facilitate movement, so that they don't just stand in one area. Having pasture mates that are maybe a little bit younger and help them move around a little bit, all those types of things can certainly help. Massage, those kinds of things. And I will give you guys a summary of all the different things that can be done. Adequan is another one that is injectable of glucosamines. That or glucosaminoglycans that helps to stimulate production of joint fluid, and it also helps to decrease inflammation. Some animals do really well on that, some not so much. Oftentimes it's a bit of a trial and error with the things that we use, and sometimes we have to add more. So it's, there's never a clear cut approach, unfortunately. Adequate injectable, which we give for twice a week for 4 weeks as a loading dose, and then we generally continue as needed. Depending on the animal, we kind of start to stretch it out and see how they do. Yeah, I hope that answered that question for Colleen. And what other questions? What do you think of laser therapy? Yes, laser therapy can be very beneficial. It needs to be done, several times a week, 2 to 3 times a week for at least 6 to 8 sessions to get some benefits. There are cold laser therapy, which is something that you could get your own little laser. They're not cheap, but for your home use, you can certainly get a laser yourself. And then we also have the class 4 lasers that are much more powerful. They get hot, so you have to move it around on the animal, and those are usually very expensive machines. So usually you can get those you can get treatments at the vet with that. You also have to wear protective glasses for laser, so even with a cold laser, don't shine into your eyes with it. But class 4 lasers are much more powerful, so the treatment length is much shorter than with a cold laser, just because you get much more into the system more quickly. All right, how do you feel? I think I answered that. All right, let me go further down. You guys are asking really good questions. Oh yeah, I should probably mention herbs. There are a lot of different herbs that also help with inflammation, including boswellia, there's turmeric. With turmeric, some dogs or animals in general, if they are a little bit more of a hot constitution, they may not do as well on turmeric, because turmeric is a very hot herb. So you'll have to kind of, see. I used to take turmeric, and for some reason I really had a hard time even getting it in, because my body just was like, really not. So I stopped. But it can help a lot. Turmeric and boswellia and some of these herbs, they can be very potent, and studies have been done, where they show that they can, even outperform some of the non-steroidal anti-inflammatories such as Rimadyl, Metacam, Carprofen, whatever all these different drugs are. There's also a newer drug on the market called Galliprant. That has worked for some of my patients, not for everybody. It's supposed to be a little bit more gentle on the body as far as the kidneys and the liver and the GI tract, because a lot of these non-steroidal anti-inflammatories, like the Rimadyls of the world, they can be very hard on the body, and so it's really important to monitor, and at any point, if they have any sort of side effects from those, such as increased drinking, vomiting, diarrhea, bloody stools, not eating well, you really have to stop those right away, because they can cause ulceration in the GI tract, they can cause kidney issues, and they can cause liver issues. So we want to make sure that we don't continue if they start showing signs, and talk to your vet right away. It's very important also to, if your animal is on any of these drugs, to do regular blood work to monitor. So I usually recommend doing blood work a month after starting, just to see what liver and kidneys are doing, and then doing some blood work every 3 months, just to monitor, just to make sure there's no issue. Cats are a different species. They are a bit of the aliens of this world, it seems like. With those, we have to be very careful because a lot of they don't do well on a lot of drugs because they don't have the same um, capabilities of detoxing the drugs and breaking them down. So we have to be really, really careful. So never use any sort of over-the-counter drugs with your cats without consulting with your vet first. Because Tylenol, for example, just one tablet is deadly. So we don't want to do that. With dogs as well, it's always better to consult with your veterinarian with any drugs that you want to give. I'm not a big proponent of just doing things yourself. When it comes to drugs and other things, it's always good to consult with your veterinarian because we are trained, to answer your questions, and we do want to help. And we're more than happy to do that. And if we know what the issues are that you're dealing with, we can help you. If we don't know, it's a little bit hard, and it doesn't necessarily have to be all pricey, and but we definitely want to help and be consulted just to make sure that we can keep your animals safe and healthy. So anyway, so drugs, there's this Galliprant is a newer one, but just like with any new drugs, they always say, well, they don't have a lot of side effects, and they often don't test them for very long, so we don't really know. But it's supposed to be less harsh on the liver and the kidneys and the GI tract, so certainly something that could be tried on dogs. But again, every drug can have some side effects. And then there are some other drugs like gabapentin that helps with nerve pain that can be helpful, but it tends to be a little bit more sedative. But anyways, I don't really want to talk too much about drugs, but sometimes it really is necessary when they're in pain, to give them some relief because quality of life is important. All right. What else do we have here? I have a 7-year-old toy poodle, Annie, with early onset arthritis in his neck brought on by trauma. Will his life be short? I'm currently using Devil's Claw and Ease by Phytopet. We tried hydrotherapy, but it made it worse. Physiotherapist helps him. Yeah, when they do have any sort of issues, you just have to do maintenance and do as much as is needed. For animals that don't have much going on, I usually start, with a little chiro once a month and see how they do. And depending on what I find, I recommend more or less. But if they have arthritis, then, if they have like a newer issue, I always start them out with weekly acupuncture and chiropractic work and laser for a few weeks. And then we start extending. So if you already know that your, toy poodle has some early onset arthritis, you definitely want to make sure that that you maintain and don't stop. Because one of the things that I see sometimes is that, an animal has some back issues or neck pain or something like that. They come in, we resolve it, they do all better, and then I don't ever see them again until the next episode where they have screaming pains because all the nerves are pinched and everything. So I recommend, if there is a pre-existing condition, a little bit of a weakness, make sure you continue with the maintenance and don't wait until something happens again. Because some of these neck issues, they can be very, very painful for the animals. So we don't want that. So definitely, I don't know that his life will be shorter. If you do maintenance and work on it and keep up with it, he should be able to have a really good life. I mean, it depends on what exactly is going on. I can't really judge that, but there's a lot that can be improved and maintained, and who knows, maybe he'll live even longer than a dog that never gets any support. So just keep on top of it. Can acupuncture help a dog with hock issues? Yes, definitely acupuncture can help because anytime there's pain in the body, it means that there's a stagnation of energy. And acupuncture, what it's really good at is at relieving that stagnation of energy in the body. So it can really help improve mobility and so on. But definitely also I would recommend some chiropractic work just to make sure that the muscles that are stabilizing the joint and helping to move the joint, are getting proper nerve input from the spine, because properly toned muscles will keep the joints more stable. So that's important. What about red light therapy versus cold laser? They're both good. You just have to try whatever, works for your animal. Sometimes they will also let you know what they prefer, so that's always good too. You can also do both. I'm a PEMF, acupuncture, and photonic therapy practitioner, and get good results for arthritis, injuries, inflammation using these modalities. Leslie, that's awesome. Thanks for doing what you're doing. That's very good. Emma, how can I shrink a mast cell lump without surgery? Well, that is a different subject entirely. We're kind of sticking to arthritis here, but I will respond to your question later. Annie, thank you. He has gabapentin when he's having a flare-up, but so far this year he has not needed it. We'll definitely keep on top of it. Yes, more than just, gabapentin, get regular body work. I'm assuming you were the one, you were the one with the question about the neck. So very good. All right, you guys, I think I got to the end of the questions. And it's 11 o'clock, so at least where I'm at. So thank you so much for having been here. It was a pleasure talking to you guys, and thanks for hanging in there with my technical issues. It's just life. Nothing is ever perfect, right? But anyways, if you guys have any questions anymore, let me know. Again, I do have a video series that also talks a little bit more about how to maintain the nervous system, which helps very much with arthritis, about vaccines, that also helps with some of the questions about the immune system. And if you want to sign up for the newsletter and get the cheat sheet, I have added the link into the comments somewhere at some point. I will do it right now again here. There we go. So that you have those, and please share with your friends and families. Spread the word, because we all want to have less suffering in this world and have our animals feel better. So, pass it on. You're the ones that are the transmitter of information. I just put it out there, but it's you spreading the word. We're a village, and it takes a village to, heal the world. So, anyways, thank you so much for taking the time on your Sunday to be here. It's a pleasure. You guys are so awesome. I love you. And big hugs to all of your animals as well. And have a really wonderful Sunday. I'll see you soon. Bye.